Hi, I'm Rachel Martinez. I'm the nurse consultant for paediatrics and I'm here today to talk about meningitis. So depending on the cause of meningitis, so if it is bacterial meningitis, this is treated with IV fluids, so fluids through the vein, antibiotics that are also given through the vein, and oxygen. Viral meningitis will usually get better on its own and can take 7 to 10 days, but this can be managed at home. However, it can be unbelievably difficult to differentiate between the two, so hospital tests to distinguish would be crucial. Yes, there are vaccinations that can help protect against some of the causes of meningitis. Some of these vaccines include the MMR and the MenB vaccine. So all children are encouraged to undertake the vaccination programme that is offered to them. The meningitis vaccines start from the age of 8 weeks old and children will continue on the immunisation programme, receiving their last meningitis vaccine at the age of 16. The meningitis ACWY vaccine, which is typically given to teenagers at the age of 16 or those who are about to go off to university, usually lasts for about 5 years. Following this vaccine, there is no requirement for any booster unless there was for any specific purpose that was indicated. It is very, very unlikely for someone to get meningitis more than once. However, there are different viruses and bacteria that can cause meningitis. So where one person might have built up an immunity to one, there is always the possibility that a different variant in a different virus or bacteria could cause meningitis again, but it is very, very rare and very unlikely. It is very unlikely that you would mistake meningitis for chickenpox purely because of how unwell the child would be with meningitis, and also the distribution and the appearance of the rashes is very, very variable. The chickenpox rash is likely to be raised and bumpy and have fluid-filled blisters, whereas that would not be present in a meningitis rash. No, meningitis typically can occur at any time of the year. However, bacteria such as pneumococcal that can cause things like ear infections, throat infections can be one of the leading causes of meningitis, and these are more prominent in the winter months. Therefore, you may see an increase in meningitis cases over the winter period. Yes, unfortunately, some of the long-term complications of meningitis can result in brain damage. This can include things like epilepsy, behavioural problems, issues with memory loss and concentration, and learning difficulties. Yes, in some occasions the infection can spread to the blood, which causes blood poisoning, and this is what is referred to as sepsis, which can occur with meningitis. So concerning viral meningitis, this is very, very unlikely and will usually get better on its own. However, there are instances with bacterial meningitis, if this is not treated in a timely or in an effective manner, that the outcome can be fatal. No, typically teenagers are not considered more at risk. It is actually children and the younger population that are considered more at risk of meningitis, and that is simply because their immune system is a lot more underdeveloped than that of the older generation. Yes, having meningitis in pregnancy can cause issues for both mother and baby. Therefore, we would advocate, if you were ever concerned around symptoms of meningitis, that you sought urgent medical treatment to ensure the safety of both mother and baby.